I'm Mehmet Oz. I'm the director of the Heart Institute at Columbia Presbyterian Medical Center. That's the hospital of both Columbia University and Cornell University. As a practicing heart surgeon, I spent much of my life taking care of critically ill patients. These are folks that were so sick that they would do anything to crawl back to a normal life. And with working with these patients, as proud as I was of the high-tech solutions that we had, I still found that they did not feel that they were completely healed or cured after their operations. And so working with these patients, and some of them had mechanical heart pumps, transplants, difficult reparative operations, I began to realize that there was a whole world of healing outside the walls of this academic center that could help patients recover faster and feel wholer after their procedures. And these patients taught me, as is often the case, much about what it would take to recover fully from the kinds of major trauma that we incur when we do surgery on the heart. And in part because of that relationship, we started the Integrative Medicine Center. Now, the Integrative Medicine Center focuses on helping patients deal with the trauma of surgery by teaching them a bit about how they can become empowered, how they can learn a bit more about techniques, many of them centuries old, that have been shown to be effective in their own cultures to heal folks. One of the most effective of these technologies, of these solutions, is Shiatsu, which Diego Sanchez has done a wonderful job advancing as part of the Integrative Medicine Center at New York Presbyterian Hospital. Diego and his colleagues have made rounds on the patients. In fact, they see more than 95% of all patients coming through the cardiovascular service for surgery. And by offering them therapies, including Shiatsu, has been able to help these patients, at least subjectively, recover more fully from the operations and in a more accelerated way. The specifics of how patients benefit, I'll leave to Diego to discuss, but they include observations like diuresis, in which they urinate a bit more rapidly following the treatments, as well as a bit more comfort with their breathing. And in fact, part of the therapy's success might be that it helps patients take the deep breaths, the lung-filling breaths that they must take after surgery. So I'm left thinking, why is it that these integrative approaches are sometimes difficult to afford to patients in a conventional medical setting? I think part of the problem is that there's a cultural bias about medicine. We're all part of this bias. In fact, medicine is a remarkably provincial process. The integration of medicine, or some call the alternative medicine or complementary medicine that is used, is really the globalization of medicine. Think about it. We have global media, we have global finance, but medicine has stayed provincial. So when we begin to incorporate therapies from other parts of the world and bring them into the hospital setting, it is actually making it a more global healing experience for our patients. Shiatsu is a wonderful example of that, as are many of the other options that we offer to our patients as part of the Integrative Medicine Center. Now, the logistical problems with bringing some of these alternative techniques into the hospital are significant, and they include credentialing folks who can come in and take care of your patients safely. They, of course, include how do you pay for the services, and then how do you study the services to figure out what benefit you get from the patients and from the services the patients are getting. And when we do this, we find that the best way to take charge of credentialing patients, of credentialing practitioners, is actually go and examine the practitioners, look at what certificates they have, and then observe them taking care of sick people. Find out if they're empathetic. Are they safe? Do they do things intelligently? Do they communicate well? Do you trust them? That's really the foundation to creating a platoon of people who can work on patients in the hospital. Because your patients are trusting you, and you have to trust your team members who are willing to work with them. In addition, you've got to keep an open dialogue with the practitioners. I want to have the same kind of relationship between a Shiatsu practitioner and a surgeon as a neurologist would have with a cardiologist, where you're talking all the time, you speak each other's language, and you have an expectation of what you're going to get from the relationship, and you have the practitioner come and work with your patient. On the financial side, we usually are very clear in asking that patients go out of their way, if they can afford to help us pay for some of these practitioners. That way we don't have to charge patients, and we can afford these services for all the people who desire them and need them. That's one of the reasons that so many of our patients can partake of the benefits of the Integrative Medicine Center. So I would say that integrative medicine will play a huge role in our patients going forward because they want it, and we have an obligation to afford it to them. What we can't do is to ignore the problem. We have published numerous manuscripts studying the patients that we've taken care of and the alternative medicine solutions that they desire and use. And one of those papers published in the Annals of Thoracic Surgery queried patients about whether or not they thought that integrative medicine was important to them, what they used, and whether they would talk to us about it. And it turns out that 70%, almost 3 out of every 4 patients, use some type of integrative medicine approach. If you remove prayer, which is the most common, it's still almost 50%. But interestingly, when you ask patients whether they spoke to their doctors about it, only 17% said yes. Think about that. 17% said yes. And when we asked patients would they want to talk to their doctors about it, only 1/3 said yes. 2/3 of people did not want to talk to their doctors about alternative approaches to healing that they were using. And I think there are 2 reasons for that. Either they don't think we know much about it, and that's important to know because, after all, if we don't know much about it and all we're going to do is poo-poo or ridicule what they're getting, why bother talking about it? But the other possibility is they don't want to ruin that precious covenant they have with their doctor, that precious relationship that makes them feel comfortable with you. So they're embarrassed to admit that they're looking outside the system for solutions. That's important to physicians and healthcare providers because many of these therapies have risks associated with them. For example, a lot of the herbs that start with G, ginger, ginkgo biloba, ginseng, gugolipids, these influence clotting function. So patients bleed more when they're on these herbs, and if they don't tell us they're on them, we're going to have the problem intraoperatively. So you need to have an open dialogue, and the only way to really do that is to create systems by which patients and doctors can talk openly. And that's only going to happen if the doctors actually have looked at these services, appreciate what opportunities lie, and, by the way, recognize the limitations, and can talk intelligently to their patients about them. Remember, the goal is not to endorse or embrace these therapies. It's not to advocate for them. It's to evaluate them, to figure out if they make sense or not. And as a parting commentary, I would say that traditional medicine has to look at alternative approaches because we can't have 2 different kinds of medicine. We can only have one medicine that heals. And we should all be comfortable talking about all aspects of that process. We can't ignore parts of it just because we did not learn about it in medical school or because it wasn't part of our culture as we grew up. I encourage you very much to have a good time with Diego as you share experiences on the use of Shiatsu. He's a wonderful teacher, has helped numerous patients at our medical center, and I support him without qualification on his trip through Italy. Take care.